Hello, I'm Dr. Robert Lelouch, board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to talk about low-dose or baby aspirin in pregnancy. So, low-dose aspirin is used primarily to help reduce the risk of preeclampsia, high blood pressure pregnancy, and some of the additional problems that go along with that. And you might be a candidate for low-dose baby aspirin during your pregnancy. Generally, we start that around after 12 weeks and until delivery, between 12 and 28 weeks. If you haven't gotten it by 28 weeks, it's probably not of further benefit. I want you to recognize, again, this is for informational purposes. It is not to determine whether or not you qualify. That's something you need to discuss with your provider, especially for baby aspirin use in pregnancy. Actually, low-dose adult aspirin or baby aspirin has throughout my career been recommended for things and then taken away and recommended, and its use in pregnancy has recently expanded. And so this video is made April of 2025, but the recommendations may change continually. So I urge you to look at the references that I have below the video and discuss it with your provider. But here's just a basic understanding. So we know that one of the most serious complications that causes problems with babies and with mothers and increases your risk is high blood pressure pregnancy and preeclampsia. And we have found that taking baby aspirin, if you are at higher risk, can reduce your risk. So some of the risk factors are a history of preeclampsia or high blood pressure with your prior pregnancy, or if you have chronic high blood pressure, or if you're over 35, or if you have type 1 or type 2 diabetes, or if you're overweight. And sometimes it's a combination of risk factors. It could be a higher risk because of your race. The reference will provide you some of those risk factors, but that's for you to find out from your provider. The take-home message is you might be at increased risk if you have some of those criteria that I mentioned, and you take the low-dose aspirin, baby aspirin, and that will help reduce your risk of the high blood pressure pregnancy. In my practice, I've seen it work quite well. I've had patients who had preeclampsia, the most common reason, and then the subsequent pregnancy, we've given it to them, and their recurrence rate has been substantially reduced. So I'm quite pleased with the use. One take-home message as well, it's not full-dose aspirin. We don't want you to take regular aspirin, because that later on in pregnancy can affect the baby's circulation. That's why you don't take full-dose aspirin or Advil, ibuprofen, any of those. But the low dose, which is only 81 milligrams, which is about 1/4 of the regular dose, has an effect on your platelets in such a way that it reduces the risk of that problem. So I hope you found this information of value. Please leave your comments. Thank you.